Hey, good morning, everyone. Welcome back to the Monarch Plastic Surgery YouTube channel. Dr. Leahy here. One of my favorite topics is breast implant safety and technology. I think over the years of my career, I've worked with just about every single breast implant that's ever been made in some fashion or another. And they have come an extremely long way in terms of their safety. And I wanted to demonstrate that a little bit today here. This is an older style of a silicone gel implant. I cut this open actually a few weeks ago and just kind of been letting it sit out here. And you can see if you cut just a sort of a little incision in the shell, how easily this gel can basically come out of the actual implant. And the material is extremely sticky. So in a ruptured implant inside the body will make a little wall of scar tissue around it called a capsule. And every single breast implant's put in, even healthy ones, the body will make that little capsule to sort of wall it off. But in situations where there's an implant rupture, that can become very thick and become problematic and uncomfortable and those sorts of things. But yeah, so this is what would happen if you cut up one of the older style of silicone implants, which we really don't use anymore, at least in our practice. This is now our go-to implant here. This is going to be called a cohesive silicone implant, sometimes referred to as a gummy bear implant. They're not really called that, but as the name implies, you'll see that this is almost more like if you were to cut open a gummy bear candy, where and you can squeeze and squeeze and squeeze on this thing. When you let go, it just comes right back into the shape, and it has a little bit of tack to it, a little sticky, but not nearly this kind of situation that we have here. So if you try to compare these two, you'll see the difference in that. So even with a rupture of this one, you may not even know there was a problem. Matter of fact, surgeons wouldn't know either. So we use ultrasound tests to kind of check the shell of the implant and just be sure that everything is okay.